Hi, my name is Roshan Dhand. In 2024, our society and healthcare systems face a major issue: the effects of the COVID-19 pandemic. Today, I'll be presenting my project about the rise in deaths from firearm injury and drug overdose during the COVID-19 pandemic and its impact on organ donation in the United States. To begin, organ transplantation is a cure for people with irreversible loss of organ function. Organ donation relies on deceased donors, meaning any change in the number of deaths or the cause of deaths in the general population will impact the transplantation process. In 2022, a total of 42,800 organ transplants were performed in the United States, continuing a 12-year record trend. Despite the immense growth of organ transplantation systems, our society continues to face an organ donor crisis, with more than 100,000 people on the waiting list at any given moment. The onset of the COVID-19 pandemic in 2020 posed unique challenges to organ transplantation systems because mortality trends in our society changed significantly. Early on in the pandemic, there was a sharp decline in life expectancy across all age groups in the US. And while most increased deaths were attributed to COVID-19, there was also increased hospitalizations from drug overdose during the early pandemic period. This intersected with 13% of adults reporting new or additional substance use during this time. Panchal et al. Concluded that the drug overdose death rate rose by a staggering 50% in the early pandemic period. Additionally, another concerning trend during this time was that 2020 saw a 64% increase in gun sales compared to 2019. Additionally, surveys revealed that these new gun owners had higher rates of suicidal ideation and mental health problems. Kegler et al. Showed that the firearm homicide death rate rose by 34.6%, and firearm suicide rates remained high in the early pandemic period. Both drug overdose and firearm injury death rates rose significantly in the early pandemic period, which can be attributed to several social factors, including pandemic-induced stress. So, what impact did these changing death trends have on organ donation? Well, Ahmed et al. Conducted a survey across 19 different organ procurement organizations in the United States, and they determined that organ donation decreased significantly in the first 3 months of the pandemic. However, of the transplants performed, the number of organ donors who died of trauma decreased by 4.5%, while the number of donors who died of substance abuse increased by 35%. However, a major limitation of the study is that it overlapped with the initial lockdown period, meaning it is not reflective for the rest of the COVID-19 pandemic. This leads into my gaps in research. First, did the changes in death trends and organ donations noted in the initial pandemic period persist? And secondly, were there any demographic, gender, regional, and racial disparities associated with these trends? The goal of my study was to analyze data on firearm injury and substance abuse death in order to achieve the following aims. First, to understand the impact of the COVID-19 pandemic on death trends past early 2020. Two, to assess whether changes in the general population were associated with changes in organ donation. And three, to identify risk factors and disparities in the study population. My hypotheses were as follows. First, that the surge in substance abuse and firearm injury deaths observed in the early pandemic period would persist into 2021 and would be correlated with an increased number of organ donors from these two causes, and secondly, that there would be certain at-risk populations that observe higher rates of these two causes of death. In this study, my role was to retrieve data from databases and perform the final data analysis and organization, while my mentor's role was to supervise this process and perform the initial data analysis. This retrospective observational study was conducted with a study period of 2014 to 2021 and a study population of U.S. adults aged 18 to 75 years. First, we utilized the Center for Disease Control, or CDC Wonder database, which contains data on every death recorded in the United States. We organized these deaths into two groups: people who died of firearm injury and those who died of substance abuse. Then we collected demographic data regarding their gender and race, and then geographic location based on census division and urbanization level. Next, we used United Network of Organ Sharing, or UNOS database, that has information on every organ donor and recipient in the US. We organized these donors into two groups: donors who died of firearm injury and donors who died of drug overdose. Then we recorded their gender and racial groups. However, there was no socioeconomic data available for donors, which is a limitation of this study. RStudio and Excel were used to complete statistical analysis, with significance defined as a p-value less than 0.01. We conducted four different statistical analyses. First, we calculated the crude rates of death per 100,000 population, which is a standard calculation that will tell us the incidence of deaths from firearm injury and substance abuse. Second, we calculated the average annual percent change from a joint point regression analysis to understand how these crude rates changed year by year from 2014 to 2021. Then we were able to determine the correlation between changes in death trends in the general population and changes in organ donation through a Spearman's rank correlation coefficient. And lastly, we used a Poisson regression analysis to verify that each demographic group was statistically different from one another. Here are the results of my study. As shown in Figure 1a, between 2014 and 2021, the average annual percent increase in death was 16.4% from substance abuse and 3.4% from firearms. This reflects the growth in firearm injury and substance abuse deaths in the general population in the last decade. Most notably, there was a significant increase in both firearm injury and substance abuse deaths in the general population during the pandemic period, starting in 2020 and further worsening in 2021. As shown in Figure 1b, a similar trend is depicted. The number of substance abuse donors increased 10.9% per year, and the number of firearm injury donors increased by 2.1% per year, which reflects the immense growth of organ transplantation systems. However, most notably, there was a significant increase in both organ donors from firearm injury and substance abuse death starting in 2020 and persisting to 2021. Most importantly, we were able to establish a positive correlation between the increase in deaths noted in the general population during the pandemic and the increase in organ donation from substance abuse and firearm injury death. This shows how organ transplantation systems directly relied on these two causes of death during the COVID-19 pandemic period, which is a novel finding and the crux of this research. In Table 1, I depict the demographic characteristics of the general population from 2014 to 2021, sourced from the CDC Wonder database. The highest crude rates of death from firearm injury and substance abuse were noted in Black and Native American populations. Additionally, men were 6 times more likely to die of firearms than women and 1.5 times more likely to die of substance abuse than women. Also, the highest rates of death were found in East, South, Central, and non-core non-metro regions, which are mainly in the rural South. Understanding which regions and individuals are most affected by firearm injury and substance abuse death is paramount to guiding public health policy. In Figure 2, I depict trends in organ donation. From 2014 to 2021, the number of donors from substance abuse death increased by 362%, and donors from firearm injury increased by 142%. As a percent of all causes of donor deaths, drug overdose increased from 7.9% in 2014 to 17.1% in 2021. It is important to monitor these trends in organ donation because the cause of donor death is important and can impact the function of a donated organ. Substance abuse donors can have a greater risk of transmitting infections like hepatitis C to the recipient, meaning they require antiviral screening to ensure organ viability. Additionally, firearm injury can cause organ dysfunction related to excessive blood loss. Given that the number of substance abuse donors has increased greatly in the last decade, hospitals would be advised to expand the use of antiviral screening processes. Table 2 shows the demographic characteristics of organ donors from 2014 to 2021. This revealed numerous statistics. First, while males comprised 60.6% of all organ donors, they were 83.3% of firearm death donors. Also, while whites comprised 67% of all donors, they were 80% of substance abuse organ donors. And lastly, while African Americans comprised 15.2% of all donors, they disproportionately comprised 25.4% of firearm injury donors. Many of these discrepancies in organ donor rates can be attributed to organ donation hesitancy among minority populations. Understanding these discrepancies can help guide organ procurement organizations to optimize the use of organs and ensure equitable access to organ transplantation. These results verified both of my hypotheses. First, we found that the increase in firearm injury and substance abuse death noted early in the pandemic did persist into 2021, and it was also correlated with an increased number of organ donors from these two causes. And secondly, we identified several populations, including rural populations, African and Native Americans, and males, who are more at risk for these two causes of death. We also identified related discrepancies in organ donation during the study period. What are the applications of this research? This study is a first to generalize nationwide death trends to better understand the long-term effects of the COVID-19 pandemic on the US population. These findings enable health professionals to evaluate how social determinants can be used to predict the impact of diverse natural disasters such as COVID-19. This is what I aim to do in this supplemental piece, which depicts the regional variations of various social determinants, which have been used to identify vulnerable populations in the past. Let's break this figure down into multiple parts. First of all, it is interesting to note that there is an overlap between substance abuse deaths in 2021, shown in Map A, and firearm injury deaths in 2021, shown in Map B. The darker regions mean that there are higher rates of death for the chosen variable. Even more interestingly, we see that maps A and B also overlap with poverty in map C, lack of health insurance in map D, and income inequality in map F. Take the state of Louisiana, for example, which observes both a high firearm injury and substance abuse death rate shown in maps A and B. We find that Louisiana also has a relatively higher population in poverty shown in map C, lack of health insurance in map D, and income inequality in map F. This is an example of the intersection between many common societal risk factors and high rates of firearm injury and substance abuse death. Perhaps most important, however, is Map E, which shows the Community Resilience Estimate, or the CRE. The CRE index compiles many risk factors to identify which populations were most at risk during the COVID-19 pandemic. However, by visually comparing Map E to Maps A and B, we found that the Community Resilience Index is also predictive of substance abuse and firearm injury death. We found that states with the highest percent population exposed to 3 or more risk factors also have higher substance abuse and firearm injury death rates. While these are only visual connections, this helps us understand how the rise in firearm injury and substance abuse deaths are related to other social risk factors. With a better understanding of the complex interplay of these social determinants, we can create a more resilient society. For instance, we can guide public policy to create targeted interventions for at-risk populations, and guide transplant centers to optimize the use of organs to expand the donor pool. What is important to understand is that all of these deaths are preventable. We, as a society, can enact positive change to reduce firearm injury and substance abuse deaths. For instance, we can reduce poverty and create other protective measures, including safe gun practices and background checks. This research also exemplifies how we need to restore our outpatient counseling and other related healthcare services to the pre-pandemic levels, which would hopefully limit these excessive deaths in the post-pandemic era. Future research would involve further monitoring mortality trends using CDC datasets from 2022 and 2023 to get a more enhanced understanding of the impact of the pandemic in our society today. Additionally, we would like to source socioeconomic data for donors to understand the regional disparities in organ donation. Even 4 years after the onset of the COVID-19 pandemic, many at-risk populations continue to experience hardship. Oftentimes, the effects of the COVID-19 pandemic relate to several other social issues, including the opioid epidemic, organ donor crisis, and high suicide rates. When conducting my research, I discovered many concerning statistics. Most notably, that in 2024, almost 40% of the US population knows someone who died from a drug overdose. There is a high chance that either you or someone you know has been impacted by substance abuse or these other social issues in some way. And this is why it remains truly critical to understand the implications of the COVID-19 pandemic on at-risk populations on a nationwide level, and how we can design interventions to combat these effects. To summarize, this novel study found that the impact of the COVID-19 pandemic on rising substance abuse and firearm-related deaths persisted to 2021, and correlated this increase in death with increases in organ donation from these two causes. And we were able to identify several risk factors which can be used to design targeted initiatives in our society today. Once again, my name is Roshan Dhand, and I thank you for listening.